I want to introduce Kiah Williams. So Kiah, over to you.
Hi, Alton. Thank you so much for having me. So I'm super thrilled to be here. And again, thank you guys so much to really talk about issues in healthcare. So access to medications. We all know that our healthcare system, it's expensive and it's complicated. What you might not know is that more people actually die from not taking the medications that they need than opioid overdoses and car accidents combined. So really, when you look at prescription drug access, like literally someone not taking a medication and dying at that great of a rate. So 1 in 4 people in the US actually report some challenges with filling their prescription drugs. So in part, it's a fairly opaque system, um, and it could be that the medication is something that you really need for a chronic condition. It could be something, that you maybe put on file. But basically, 1 in 4 people are having this issue. So we know that this is a large scale issue. When you break down that 1 in 4 folks, what you actually learn is about 10 million people are low income and have at least one chronic condition and have some trouble affording ongoing medications that they need, not just to be healthy, but literally to live. And so, what are the trade offs that people are making? We've heard stories from rural Georgia all the way to Denver, all the way to San Francisco Bay Area, where folks are making the decision between sometimes basic things like shampoo and conditioner, or rent. And so, love that segue of the two mayors just speaking about universal basic income and the need for people to have additional money to pay for the things that they need. So in America, we actually spend the most on prescription drugs than any other developed country. So on average, a family spends $3,000 a year on prescriptions. Let's break that down though. When you're talking about lower income families, that ends up being about 8 to 10% of their total take home pay. So that's the amount of money that they have, they're actually spending the same amount on prescription drugs as they actually would spend on food for their family. So literally, this decision, this terrible choice that people are making is between groceries that they need to put on the table for their family and prescription drugs. And so often we've heard stories of families, in particular parents, who, when given the choice between putting groceries on the table, paying the light bill, paying their rent this month, and the medication that they need that they hope will prevent them from having a heart attack or a stroke several months down the line, years from now. The unfortunate truth is that most families are going to choose the now. They're going to choose the things that they need today for their family, and they're going to put off or cut in half or skip every other dose to make sure they can actually provide for their families. In particular, during this pandemic, during COVID-19, about half of families in the US have reported serious financial problems. And it shouldn't be a surprise that that number jumps to over 70% of low income families who already didn't have a strong safety net of finances, of credit, and resources that they can use to really float themselves. And so the question that we often get asked is around, out-of-pocket costs and coverage and insurance. So yes, one of the big challenges of these 10 million folks who are skipping prescription drugs because of cost, about half of them are uninsured. And insurance is a necessary but not sufficient part of this equation, because increasingly what we're seeing is folks who are underinsured, meaning they have some sort of coverage, healthcare insurance. But one of the big challenges for these families is often what their out-of-pocket costs, be it copays, deductibles, co-insurance. It's extremely complicated. And we've seen some folks who have deductibles that range in the thousands of dollars. And so the question becomes not just, does someone have insurance? Do they have medical coverage? The question really becomes, what is the cost we're expecting families to pay? And for prescription drugs, at a household annual cost of $3,000 a year, the same amount that low-income families spend on groceries, the cost is simply too much. At the same time, while 10 million folks are not getting the medications that they need, 1 in 4 people in America are experiencing issues paying with their prescription drugs, and this is all exacerbated by this pandemic. There's over $11 billion of unused medicine that goes to waste. So I'm not talking about the medicine that you have in your cabinet. Oftentimes when I meet people and they hear what we do, they automatically want to give me those 5 tablets of an antibiotic they have from an infection that they had last year that they just didn't take. So I am talking majority of these medications are actually surplus that already exists in our supply chain and exists at institutional setting levels. So there's basically 2 reasons for institutional surplus. One is just planned surplus and planned overproduction. So we all know that the large scale costs in manufacturing and pharmaceuticals is in research and development, way less so than the cost of production. And so at the top level of the supply chain, surplus medicine is just, everyone pads their inventory a little bit because the cost of last sales is just not worthwhile. You might as well have a little bit of extra. So that's one reason why you'd have surplus medications. And what typically happens in these instances are there may be pallets and pallets of one particular drug. Second reason that there's surplus is actually a little bit more complicated. It's further down the supply chain. We're talking at the pharmacy, hospital, health facilities like nursing home level. And this is largely because of patient level events. So a classic example might be someone is in a short-term rehabilitation center and they've post-stroke or they've just had a heart attack and they're on a medication and the dosage changes or they're discharged or a medication is discontinued for use. So what generally happens at these facilities is that medication is taken away, put in a medical waste incinerator, and either sent to an incineration or some other destruction method. So what ends up happening is you have these billions of dollars of surplus that perfectly good, tamper evident packaging, unused, unopened, not expired. None of these are controlled substances that we're working with. It's literally medications for heart disease, diabetes, just chronic conditions that folks need assistance with in paying for these medications. And these medications currently would just go to waste. We've talked to nurses who've been in the field for 20 plus years, commenting to us about how back in the day, folks used to flush these meds. Then we knew better. And so then we started saying, okay, they need to be, destroyed properly. Now we know better than that. And we know that if we can recycle a can, surely we can recycle a $100 medication. So what SIRUM does is we use technology to connect those institutions that have surplus unused medications. We put a recycling bin in their facility, and we make it as easy as possible for them to donate rather than destroying their unused medications. People want to do the right thing. And we've worked with hundreds, thousands of nurses, and most folks in healthcare, they got into the space, they became a healthcare worker because they want to save lives and they want to improve people's lives. So it breaks folks' hearts when they would otherwise be sending these perfectly good medications for destruction. So instead, we streamline the entire process using technology. We take care of manifests. We show them what they can donate, where they can donate. We even generate prepaid, pre-addressed shipping labels. We send them all the supplies that they need to donate instead of destroying their unused medications. And this isn't all just out of the good of folks' hearts. There's actually a financial incentive to donate as well. So these facilities may actually pay thousands of dollars per pound to actually destroy these medications. So we're reducing their cost of destruction. And for many facilities, they're eligible for a tax write-off. So they're able to actually get credit for the donation that they're making. So our system basically is the logistics provider for all of this. We reduce the friction it takes to donate instead of destroying. We put these recycling bins in facilities. When the box fills up, We have a common courier deliver come the next business day, take the medication away, and then we route it to our network of charitable clinics and pharmacies that dispense medication to low-income patients throughout the country. So to date, with a fairly small team, we are still a startup. We're definitely we are an innovative, small, scrappy team. We've actually gotten over 800,000 prescriptions worth over $80 million through our system. And what's great about the way that we're working to basically redistribute rather than destroy, recycle rather than destroy, is we're providing an ongoing value add and an ongoing opportunity for folks to donate instead of destroying their unused medications. And so to date, we are growing and scaling. We're very excited to have announced that earlier this year, through a partnership with the TED Audacious Project, we're thrilled to announce that we are going to be launching next year as a part of a multi-year plan, getting about $1 billion of unused medication to over 1 million low-income patients in the United States. We are growing and scaling our impact dramatically to meet the real need, which is how do we provide accessible medications for folks? How do we push for transparency and access and cost in the healthcare system? And how do we promote health equity and justice? Because truly, no one should have to make the decision between buying groceries today and affording the medications that are going to prevent them from having a stroke tomorrow. So I think as a part of this conversation around systems resetting and system malfunctions and how do we create the future that we all want to see, where we have a society of health equity and we have one that is just, I think in particular in healthcare, one of the big challenges and opportunities is how do we create systems that focus on access first, that focus on families first, and focus on what are the costs we're expecting people to pay. There's a lot of meta level, and macroeconomics around the cost of prescription drugs and lowering that at a real institutional level for the United States, for different payer plans, et cetera. There's a lot of complexity that's engaged there and a lot of discussion that we're having as a country, continuously. But what's really important, and I think what we have to not lose sight of, is what is the cost we are expecting a family to pay for their health, for their wellness, for their well-being? And how do we ensure that those costs are ones that are transparent and ones that are accessible for every family in this country? I like to tell the short anecdote in healthcare that I think expands upon the idea of the issues that we have is, okay, you would never, ever, ever go to buy a car, not see how much a car costs, drive the car home, and get a bill in the mail a few months later. But that's what happens oftentimes when you walk into a hospital. You end up hospitalized, you may not know how much the costs are, and you get a bill months later. When it comes to prescription drugs, it would almost be similar to walking to a clothing store or a grocery store, filling your basket with food, filling your basket with clothes, and then nothing has a price tag on it, going up to the counter and not knowing how much it's going to cost until someone rings you up at the register. That is what millions of folks are facing every day when it comes to their prescription drugs. And when they get up to that counter, they have to walk away because the costs are just too high, they're not consistent, and they're not transparent. So when we talk about systems change, when we talk about creating a healthcare system that we want to see tomorrow, there are huge opportunities to leverage technology so that billions of dollars of medicine doesn't go to waste and instead goes to the people who need it most. There are other opportunities within the healthcare space to leverage and create efficiencies using technology. If we can get food delivered to us in 30 minutes, surely we can make sure folks have access to the medications that they need to stay healthy, and we can ensure that that medicine gets donated instead of destroyed. I appreciate you guys so much for having me today. Would love to have any questions or have folks reach out to us at SIRUM, and I'll pass it back to Alton.
Again, Kia, exciting business. And I know I just, again, am so impressed with how you're thinking about tackling a lot of these inequities. One comment or question we had from one of the viewers on the phone is, for your business, what are the biggest challenges, especially being in a highly regulated industry, such as obviously prescription drugs?
Yeah, I mean, I think that in many ways, the challenges are also the opportunities, like in most things. I think that one of the big challenges I would say for the healthcare sector as a whole is around what do we expect from this system? I kind of gave the example of going in, you would never go into a store and never know how much something costs. But I think that is a serious issue in healthcare, transparency and cost, and what are people expected to pay. Most folks are willing to and want to contribute towards their cost of medications. But people have to have a goal of what it's even going to cost, like how much do they need to save. It needs to be something that's like there needs to be a price tag. Like there's no price
Right.
tag on anything in healthcare. I think in part, one of the challenges and opportunities is really how you reshape what people expect from healthcare. Like we should expect less waste. Some studies show that about a third of all costs in healthcare go to waste. And these are things. There are some things that are very complicated, like how do you make efficient schedules and people resources and physical resources like MRI machines, et cetera. But for something like medications, like there's a clear opportunity and it's a physical product that we would otherwise be destroying. I think that the biggest challenge is almost resetting our minds and the framework in which we expect healthcare to operate. And I think that we're almost limited by the systems that have already existed, such that it's really hard, I think, for especially larger institutions to reimagine what we could create together. And so I think that the biggest challenge is reimagining the healthcare system that we all deserve, and not getting kind of anchored by the system that we have today. But I think that's also our mission, is to reimagine medication access. And so I think that the biggest challenge is all of us reimagining what we expect and what should good healthcare in this country look like.
Well, I know I'm excited to live in the world that you are reimagining for sure, Kia, and we are looking forward to the further success of your business. So thank you very much for really taking the time and in bringing our audience up to speed with what you're doing.